Let's talk about something I see every single day in my practice. It starts when a patient, often someone in their 60s, 70s, or 80s, comes into my office with the very best of intentions. They are trying to be proactive, to protect their health, and I commend them for it. But these good intentions can sometimes lead them down a path that, surprisingly, creates risk instead of reducing it. I'm talking about the oversupplementation of vitamins. Let's be very clear from the start. Vitamins are not the enemy. They are essential micronutrients, the building blocks of a healthy body. The problem isn't the vitamins themselves, it's the widespread belief that if some is good, more must be better. This is a dangerous myth, especially as we age and our bodies process substances differently. Let's use a very specific and common example: vitamin D. It is rightly called the sunshine vitamin, and it's famous for its role in bone health. Its primary job is to act as a gatekeeper, telling your body how much calcium to absorb from your diet. When you have a true vitamin D deficiency, and many people do, a supplement is a precise and necessary medical tool to bring your levels back to normal. However, many people take high-dose vitamin D without knowing their levels. They might take 5,000 or even 10,000 IU a day, thinking they're building super bones. What they don't realize is they're turning a precise key into a sledgehammer. When you overwhelm your system with too much vitamin D, you force your body to absorb far more calcium than it needs. Now your body is faced with a problem. What to do with all this extra calcium floating in the bloodstream? It has to put it somewhere. And unfortunately, one of the places it goes is into the walls of your arteries. This process is called calcification. Imagine your arteries, which should be flexible and elastic like a new garden hose, slowly becoming stiff and brittle. This arterial stiffness is a major contributor to high blood pressure and an independent risk factor for cardiovascular events, including stroke. The very vitamin you were taking to stay healthy is now, silently, creating a condition that compromises your vascular system. The most frustrating part of this is that the patient often feels fine. There are no warning signs until the damage has accumulated. This is why my first principle of supplementation is test, don't guess. Before you begin any supplement, especially vitamin D, a simple blood test can give us a baseline. It tells us if you even need it, and if so, what precise dose is right for you. Your health is too important for guesswork. Earlier we discussed how taking too much of a single vitamin, like vitamin D, can create harm through the more is better fallacy. Today, we need to talk about an even more complex risk: the interaction between high-dose supplements and common prescription medications. This is where a lack of information can truly become dangerous. Let's talk about vitamin E. For years, it has been marketed as a powerful antioxidant for heart and skin health. Many of my older patients take it, hoping to improve circulation or memory. The part that isn't on the front of the bottle, however, is that vitamin E, in high doses, acts as a natural anticoagulant. In simple terms, it thins your blood. Now think about the common medications prescribed to adults over 60, daily low-dose aspirin for heart protection, or powerful blood thinners like warfarin, Plavix, or Eliquis for conditions like atrial fibrillation or a history of blood clots. These medications are carefully calibrated to prevent a stroke or heart attack. When a patient, without consulting their doctor, adds a high-dose vitamin E supplement to this regimen, they are essentially pouring a second blood thinner on top of the first. Their blood can become too thin to clot effectively. Suddenly, a minor fall can lead to a massive bleed. A fragile blood vessel in the brain, under a moment of high pressure, can rupture and lead to a hemorrhagic stroke. This is not a theoretical risk. I have seen this tragedy unfold in my own patients. The cause was not a disease, but a combination of a prescription and a supplement that were never meant to be taken together. Let's shift to another vitamin that can cause harm in a different way: vitamin B6. It's frequently included in nerve support or energy formulas. But vitamin B6 is a fat-soluble vitamin, which means that, unlike some others, your body doesn't easily flush out the excess. It stores it. Over months or years of taking high doses, it can build up to toxic levels. And in a cruel irony, it can begin to damage the very thing it was meant to help, your nerves. Specifically, it can strip the protective myelin sheath from your nerve fibers, like stripping the insulation from an electrical wire. The symptoms of B6 toxicity, numbness in the feet, tingling hands, poor balance, muscle weakness, are slow and insidious. Most people mistake them for arthritis or just getting older. They would never imagine that the nerve formula pill they take every morning is the cause. We've been able to reverse some of this damage in patients by simply stopping the supplement, but in some cases, the nerve damage is permanent. The lesson here is critical. Your supplement bottle does not know what prescriptions you're on. Your body is a complex system, and every substance you introduce affects the entire system. This is why my second principle is, your doctor must know everything. Don't just bring a list of your prescriptions to your appointment. Bring the actual bottles of every vitamin, mineral, and herbal supplement you take. Let us be your partner in protecting you from these hidden interactions. The philosophy I share with all my patients is simple. Food first, supplement smart. Let's start with food first. Your body was not designed to run on isolated, high-dose chemicals from a pill. It was designed for, and thrives on, whole foods. Think of the incredible intelligence within a single stalk of broccoli or a handful of blueberries. They contain not just one vitamin, but a complex symphony of vitamins, minerals, fiber, and antioxidants that all work together in perfect balance. The vitamin E that you get from eating a handful of almonds is packaged differently by nature than the 800 IU of synthetic vitamin E in a gel capsule. One is nutrition, the other is a powerful drug. Instead of a drawer full of bottles, I want you to picture a plate full of color. Leafy greens like spinach and kale for folate and vitamin K, deeply colored berries for brain-protective polyphenols, healthy fats from avocados and nuts. This is the foundation of health. This is what truly nourishes you. Now for the second part of the philosophy. Supplement smart. This means recognizing that supplements are not a replacement for a healthy diet. They are a precise tool, like a surgeon's scalpel, to be used for a specific purpose and for a limited time. Their role is to correct a documented deficiency. If a blood test shows your vitamin D is low, we will prescribe a specific dose to bring you into the optimal range, and then we will retest to make sure we haven't overshot the mark. If your diet makes it impossible to get enough B12, a supplement is a wise choice. The key words are documented and guided. You should never have to guess about your health. I recently had a patient, a retired school principal, who came in with dizziness and fluctuating blood pressure. She brought in a bag with over a dozen different supplements. We did something radical. We stopped everything. We replaced it with a simple plan for whole food meals. Within a few weeks, her dizziness was gone and her blood pressure stabilized. Her mind, she told me, felt clearer than it had in years. We then carefully reintroduced only 1 or 2 supplements that were medically necessary based on her blood work. So this is my final message to you. It is not about abandoning your quest for health. It's about pursuing it with wisdom. Prioritize food. Build your health on a foundation of real, nutrient-rich food. Respect supplements as you would any powerful medication. Partner with your doctor. Let us help you navigate this. Bring your bottles, ask questions, and demand a plan that is based on your specific biology, not on marketing. You are in control of your health. Make sure the choices you make are the ones that truly protect you for the long, healthy life you deserve.